There are so many ways to use the A-flex assist arm. My personal favorite is using the dry angle for large cheeks and patients who have loose tissue. You no longer have to worry about the suction attaching to that tissue. Tip 2. Keeping the mirror from fogging. While using indirect vision, sometimes the mirror will fog. To stop that fogging, hover the A-flex slightly inside the mouth and fog be gone. Tip 3. Using the bite block is always great for those patients with TMD. The A-flex is perfect in that situation. The suction will stay in place, which stops a water reservoir, allowing for an efficient practice and patient comfort.